Waiting for provincial approval of a plan to avoid emergency room closures in Kenora. Good evening and thank you for joining us. Kenora officials continue to sound the alarm about a critical shortage of doctors. They say there's a plan to solve the crisis, but the Ministry of Health is the obstacle. The hospital needs a green light from the government, and they need it soon if they're going to avert an ER shutdown that could cost lives. Lee Noonan has more.
We're optimistic, and at the same time at the brink and very much at risk of losing that hope very quickly.
Dr. Jilly Retson is co-chair of the All Nations Health Partners Ontario Health Team Clinical Advisory Committee. They want approval for their plan to recruit and retain doctors, and they want it fast before the problem gets worse. The number of doctors working at the ER in Kenora has plummeted from 20 down to just 9 in the last 2 years. And those left behind are all splitting their time between the ER and other clinics and at risk of burnout.
Like, so many have been just holding on, like doing those extra emerge shifts, holding on from retirement.
The degree of, I call it moral distress, that I'm seeing amongst my physician colleagues is at a level which I've never seen before.
Lake of the Woods District Hospital's president, Cheryl O'Flaherty, says they're struggling every week to keep the ER open.
We cobble together shift coverage with 2 to 3 local docs when we get down to the, fine moments. And then we say, okay, we're good for another day.
If nothing changes, they say ER closures are a very real possibility in the near future.
It was the first time I've really had to look into the pit of my stomach and think, oh, this is really real. I'm really going to have to lock the doors and tell people that I can't help. And it's a really horrific feeling.
Dr. Laurel Snyder is the hospital's emergency services lead. She estimates that they see between 15 and 30 high acuity patients in the ER on a typical day, the kinds of patients who might not make it to the next ER 2 hours away. The committee has developed a new rural generalist model, and they say they've got 10 doctors waiting in the wings and willing to sign on under that plan if it's approved. But Retson says that after a year of negotiating with the Ministry of Health, progress has stalled.
We actually have, it seems, all of our ducks in a row and everyone in agreement across the board. So we are perplexed and confused about why there is a delay and a stalling in the negotiations now. We haven't had a negotiation meeting for 2 months.
A Ministry of Health spokesperson has responded, saying the proposals are for physician services, and as the Ontario Medical Association is the exclusive representative of physicians practicing in Ontario, formal negotiations with the OMA began on this issue on July 4th. Lee Noonan, TBT News.